Welcome to another edition of Our City. I'm Chris Bolwage, and I just want to let all the viewers know that last Wednesday, March 14th, the Elizabeth High School students, 6,500 of them, all took the time to not only protest the policies of Washington regarding guns, but they came together in a very peaceful way. There were assemblies in auditoriums throughout the schools. Very few children walked out of school. They listened to elected officials, messages from Senator Booker, Senator Menendez, our state senators Joe Cryan, our state senator Nick Scutari, members of the Board of Education and City Council, and myself, as well as former Senator Ray Lesniak, members from the Sheriff's Office. They asked questions about security. They asked questions about national policy. And it was extremely proud to be the mayor of a city where 6,500 students participated peacefully in a protest of the gun policies of this nation. A few other things going around the city of Elizabeth this week. On Wednesday, March 21st at 5 o'clock in the evening, I'm going to join the Greater Elizabeth Chamber of Commerce at their Business After Hours networking event. This will be held at the lobby located at 821 Spring Street in the city. On Thursday, March 22nd at 5:30 in the evening, I will attend a Women's History Month celebration at Yoli's Cuban Cafe, located 1174 Elizabeth Avenue. This event will feature live music. It will also feature and recognize Janice Lillian, the YWCA Executive Director, as well as Assemblywoman Annette Quijano. If you need any further information, please call the Public Information Office at 908-820-4124 or the Chamber 908-355-9600. Following that event at 6 o'clock, I'm going to attend the Boys and Girls Club of Union County 2018 Youth of the Year Awards ceremony at Gallopin Hill Caterers in Union. And on Saturday, March 24th, the Department of Recreation will host a series of Easter egg hunts beginning at 9:30 a.m. in Kellogg Park. It's located at North and Madison Avenue, sponsored by the 5th Ward Councilman William Gallman. The next Easter egg hunt at noon that day in Carteret Park at the intersection of Elmore Avenue and Vine Street, sponsored by the 2nd Ward Councilman Nelson Gonzalez. And the final Easter egg hunt will be at 2 o'clock in the afternoon at Jackson Park, 211 Madison Avenue, hosted by the 1st Ward Councilman Carlos Torres. All of the Easter events will feature some free candy, prizes. Participants are encouraged to bring their own baskets or bags, camera to take pictures, and the Easter Bunny, of course, will be available. For more information, please contact the Department of Recreation at 908-820-4222. And just one correction, the Yoli's Cuban Cafe, it is not the Chamber of Commerce, but the contact number is 908-355-9600. And regarding the top of this show, talking about the students and their peaceful protest, I want to thank the president of the school board, Maria Carvalho, for a great organized effort, as well as the superintendent of schools, Olga Ugemeyer, for a great staff and team effort in not only making sure the students had a right to protest, but it was done in a peaceful and safe way. Please stay with us after these messages. There'll be more on Our City.
We're creating tomorrow's jobs today. Kane University.
Welcome back to Our City, where I'm pleased to be joined by Miss Donna Hunter, who is a certified homemaker home health aide with Community Access. Donna,
Hello.
welcome.
Hi, thank you.
Thanks for coming on the show.
Thank you.
Mr. Bill Webb, a special projects consultant. Bill, welcome back to the show.
Thank you, Mayor.
Yeah, they got you down here as William Webb. You don't mind I call you Bill?
Bill is fine. I
Okay.
prefer that. Thank you.
And of course, Miss Barbara Blaize, a resident of Roselle and a participant in the Community Access Home Health Care Program. Barbara, welcome to the show.
Thank you very much, sir.
So before we begin, maybe we can start with you, Bill, and tell us about Community Access Unlimited, what it exactly is. Tell me your role there and refresh our viewers. But it's good to see you back on
Nice
the show.
to see you back too, Mayor Village. Yeah. Community Access started about 1979, so we're almost 40 years old. And it started in response to the need for community transition for people with disabilities from institutional care to community living. So with almost 40 years of experience helping people with disabilities with residential services, community supports, all kinds of wraparound services, we have lots of experience helping people to live safe, secure, and independent lives in the community. We serve about 350 people in Union County in residential care. That also includes some youth who've been transitioning out of foster care. And then another 200 or 300 with community supports just in Union County alone. And then statewide, about 6,000 people altogether are served by the agency. A variety of services, including financial management, recreation, social activities, money management, employment, training, educational programs, all kinds of things that are necessary to live a fully independent, self-sufficient life.
Thank you, Bill. And Donna, how long are you with Community Access? And tell us your role there as well.
Yes, I've been with Community Access. It'll be 6 years in August. I started as an assistant support counselor, working hands-on with the disabled. And I did that for 3 years, and then they offered the home health care program. So I signed up for the Community Access Home Health Aide program, and I became a senior home health aide. In March, it'll be 3 years.
Now, do you work with Barbara, or do you help?
Yes, Barbara is one of my clients, and I take Barbara out shopping. We go grocery shopping. I take her to doctor's appointments and, home care to show her activities of daily living because she is disabled.
So, Barbara, tell me about yourself. And first of all, thanks for taking the time. I know you walk with a cane, and you came all the way here to Kane University and get up here to do the show. So that's a real thanks from me to you. I appreciate it.
Thank you for having me. Yes, Donna is my assistant, I should say, and I've never had that. I've been a viable citizen of Roselle. I am a former airline employee, but I had to go on disability because my daughter had been diagnosed with cancer. Okay, so I had to take care of her. But just recently, I had a hernia operation, which the mesh broke, and I became paralyzed. I was in the hospital for 9 months, and I had the beauty of meeting Joanne Hamilton from the social worker that we had, because as a Medicare recipient, we only have 6 hours. Once you get the 6 hours, you're gone. You don't get any more help. And I was unable to walk, okay? When I met her, she said I was viable to be a client. And from the first day I met Miss Hunter, Donna, she picked me up because I didn't want to live as a person, okay? I'm not used to not being able to walk. And I'm walking.
You told me you've been walking since October,
Yes,
before
sir.
we started taping the show.
Yes.
Feels great, right?
Well, at first I was frightened. I'll be very honest with you. The things that I used to swim 3 days a week. Okay, I'm a community member. I work for Christine D'Angelo. I know you know her.
The great mayor of Roselle.
Right, right. And I ran for committee person. So I'm viable. I volunteer. I work for Presbyterian Daycare Center. I'm on the board there. I can't now. I can't get up the steps. But I'm getting up the steps. She's
Yes.
helping me. And that's what we need. We need more aides or home health care people with the initiative to get people like me back.
So can I ask, when did Community Access get involved in the home health care side of the ledger here?
Actually started in 2015. I think Community Access realized that, first of all, we already were providing a whole range of health services for our residents in our community, in our programs. So we have lots of nursing expertise and lots of connections with medical practitioners and hospitals and stuff like that. And we realized, especially as our population was aging, there are more and more issues that come up that need attention. And then we realized it was true in the general community that Elizabeth and Union County's senior population is growing. I think there's 12,000 seniors over 65 in Elizabeth and 74,000 in Union County.
You know, I went to the JFK library with my daughter recently, and I actually got the senior discount. I felt really bad about that.
Enjoy
I
it.
saved $2. I was like, wow.
Enjoy it for many
I didn't
years.
know whether that was a good thing when the woman said to me, do you want the senior discount or not?
So you've arrived.
I was afraid to tell my wife that I got this. But anyway, I didn't mean to interrupt you.
No, that's good. That's good news. So there's a growing senior population, and then of course we're concerned about the population of people with disabilities in Elizabeth and Union County. I think there's 8,000 folks under 65 with disabilities in Elizabeth and something like 32,000 in the county. So there are many, many people, many more than we currently serve, who are in an at-risk situation as they get older and as their health conditions may decline, or maybe they have a chronic illness that needs maintenance and care. Most people would prefer to live at home as long as they can, rather than going to a nursing home or assisted living. And home health care provides an alternative with personalized care for people to help them maintain independent lives in their homes, which is that's how we got into it.
That's how you got into it. So
Yeah.
Donna,
Yes.
and you've been doing it since 2015, right?
Yes,
And
I started actually in 2015. It'll be 3 years. The 21st of this month, I have an
So
anniversary.
what kind of help do you provide to people as they age? I mean, we just heard
Yes.
Barbara's story, and we're going to go back to her in a few minutes. But
Yes, I
what's
help.
the overall holistic efforts that you
Yes,
do?
I help them with experiencing everyday activities of living. To teach them how to get back into cooking, to learn how to take their medications on time, to teach them how to walk. Some of them can't walk; they're using walkers. Doing range of motion exercises to help them with their limbs and muscles, and medication reminders. Taking them up to appointments to dentists and doctor's appointments to remind them of those things that they need to do. Taking them grocery shopping, for nutrition, picking out nutritious foods and things for them that they can have to,
You
to
did
help
go
them.
shopping for me.
Yeah,
She's
to help
good.
them. Yeah,
Good, huh?
Yeah.
She's good.
She's good,
She
Barbara?
knows all
Yes.
the people in the
Yes.
In the supermarket?
Yes,
Ah.
yes. Pick out the
You get
most
deals too?
nutrition.
you do the coupons and all that stuff?
Yeah, we can do coupons, yes. But just to help them look at the nutritional value that they need to help themselves, to become more healthy for themselves.
So Barbara, one of the questions has here, it's no secret that more people are living longer. There's a big need for home health care. So do you see that in your case? I mean, because you've rebounded so well?
Yes, because having worked for 2 airlines, I should say, I have always been on the go. And so when I was able to volunteer, sometimes volunteer with income, I would do that because I'm learning. Then I went back to college. I went back to, Union College, to learn more computer aspects, because if you don't, I have a computer now, but you have to keep up, all right? And she, as an assistant, that keeps my mind going, and she helps me. Okay, Miss Blaize, let's go. And we need it, but you have to have that personality. And some of the aides don't have it, but this young lady here does.
Miss Hunter here does have
Yes.
it.
Yes.
So Bill, how does this fit with the mission of community access in the overall direction? I mean, I heard some fascinating stories from Donna and Barbara, but overall, how does it fit with the overall mission?
Well, I would say our overall mission really is to help vulnerable people to live self-sufficient, independent lives as much as possible in the community and in the residence of their choice. And so, again, we began with the population of people with disabilities of any ages coming out of institutions. Then we took on residential care for teenagers and young adults who are exiting the foster care system, and we're like the last step on the road to adulthood. And then, we've done a lot of work in the communities to just help strengthen community connections, community service provider networks. There's a countywide youth service network that helps youth, and many agencies are part of that. There's a county-wide interfaith council. You may be familiar with that. That meets every month, representatives of many different faiths in Union County, to talk about interfaith appreciation and understanding, and then to talk about what kinds of services the community needs and help people link up. And then there's a Union County Nonprofit Directors Consortium, I think about a dozen or so agencies where the directors meet on a monthly basis to share ideas, strategies, approaches that work. That helps to strengthen the networks of community providers. So I think when we see other emerging vulnerable populations, we want to see if our skill set and our experience can work to help that population. And so that's the case with seniors and then folks in the community who also are living with disabilities.
So Donna, we talked about some of the most important issues before. Do you only deal with adults with disabilities?
Well, yes. At this point, yes. I just deal with I'm just starting to get more seniors because I did work with adults that were like in their 30s or 40s. You know, I work with them, but now I'm getting more seniors because, as Bill said, it's more demand for senior home health care. You know, they tend to. They need assistance in the home because, like he stated before, a lot of people want to stay home. They don't want to go to a facility. They don't want to go to a nursing home. They want to have care at home. And some of the family members aren't able to provide that care for them, so that's where we come in.
So Donna, the services you provide, who actually provides the services? I noticed Barbara said you do yourself, but
Yes.
you're not the coordinator.
No, we have the director of nursing. I have a director of nursing, and we have a nursing supervisor. And then we have the person above them that provides the services. And as Bill goes out and finds these clients for us to take care of.
Okay. Can you stay with us? We're going to do a little commercial and then come back and talk more about this program.
Sure, great.
Okay.
Yep.
Please stay with us after these messages, back with more about the Home Health Aide program at Community Access Unlimited.
We're an American original, dependable, historic, nuanced, with all the comforts of home, even when you're just visiting. So we're celebrating for all that we've left untouched and all that we've changed. A place where the past meets the future. So consider this your invitation.
We've been celebrating here in Elizabeth for 350 years, and we're just getting started. Welcome back to our city. You know, before the break, Donna, we were talking about how you get to be a homemaker, a home health aide. And you said, I'll tell you. So go ahead and tell me.
What I was going to say was that the Community Access Unlimited offered the home health care program. So I was working in Hillside 2 as an assistant support counselor, working with direct care with the clients. And I asked my supervisor to sign me up for the position. So she signed me up to take the classes, and I took the classes, and I passed the classes, and we had to get our license through the Board of Nursing. And once I got my license through the Board of Nursing, I was the first one to get hired as a home health aide. I was born and raised in Elizabeth, and I'm a long-time Elizabeth resident. I still live here, and I would never have guessed in a million years that I would work working in the city of Elizabeth. So I'm very happy and excited to work for Community Access Unlimited. And I'm so grateful that they did offer this opportunity for me to extend my compassion and empathy for other people.
You're good at this. I could
Told you.
Yeah, right? Now I know why you like her, Barbara. I mean, really.
told you.
How much time does she spend with you during the course of a week?
Well,
Every day, 3 days a week? How
Well,
does
it's
that
only
work?
2 days, and I think it's 4 hours or 3 hours on Tuesday, and only 1 hour on Thursday, which I would love to have another hour.
But would you like
I'm-
to see more people become these community health, homemaker health aides?
Yes.
Tell me why.
Well, because in my case, I'm able, I belong to the Roselle Active Seniors, okay? And when this incident happened to me, I couldn't go back to the meetings. I was the meet-a-greeter. When you'd come into the center, I was the first person you met, okay? Couldn't do that. I'm in the hospital for 9 months. But since I've been in this program, I've been to 3 meetings, and we take trips as seniors. We used to take a trip every day. I mean, the trips would be going to the shopping, going to the bank, because Roselle offers that to the seniors, and you don't have to be a senior. You could be 40 years old and disabled, or 30 years old and disabled, and they help you. But you need the aides to help that person to continue. You have people who are still living in their houses and want to stay, they're homeowners, and they want to stay there. They don't have any relatives. The kids have moved away, okay, and then they're there. This contract enables, not enables, but enables us to be able to help the homeowner or taxer like me. I'm not a homeowner now, but I'm just saying, people who are paying taxes, they need this particular help.
So, Bill, what kind of training is required for this, or experience?
Well, for the homemakers, they actually 76 hours, I think it is.
Yes, we go through 76
coursework.
hours of extensive testing. We go through transfer training, Hoyer lift training. We're taught how to use a walker, use a cane, use the Hoyer lift to lift a client out of bed if they're bedridden. We're taught insulin training. We have diabetes training, Alzheimer's, dementia. We do monthly tests. Every month we're given a test, a different test, to keep our skills up to point.
And
So it's ongoing education.
So it's ongoing,
Yes.
yeah, so, which is important because as things change,
Yes.
they're trying to make sure you're aware of it. So is there a limit in any way, shape, or form what you can do for a client?
Yes, as far as home health care, as a certified home health care homemaker, we cannot take care of a client that, say, has a feeding tube. We can't do the feeding tube, and we can't administer medication. We can't give medication. We can only do reminders. You know, did you take
You bring
your
wine and
medication?
scotch, though, right? No, just kidding. Just kidding.
No, we can ask them, did you take your medication today? They can tell us yes, and we can look and see, you know, the medications, if their medications are out, or did they take them, you know, we don't know for
So,
sure.
but you would line them up for them too, right? Like on
No,
Monday,
we
Tuesday,
can't.
Wednesday, you can't do that?
No,
No, okay.
no, we can't, you know.
You can encourage them to do it, though,
yes,
right?
Yes, we have to encourage
Take
them
these
to
on
take,
Monday, right.
yes, we can encourage them
So,
to take medication.
What happens if there's an emergency when you're with the
If
client?
there's an emergency when I'm with the client, I automatically call the director of nursing, or I call my nursing supervisor, because they're on call 24/7. I can call them, but if it's a dire emergency, I'll have to dial 911 and
you're
then
prepared.
contact the supervisor. Yes.
So Bill, there's also home and property services as part of this program?
Yes.
And like cutting the grass and yard care and
We
all
can do that.
deep cleaning. I'm looking at this. Clutter removal, home repairs, residential modifications. So do you do any of this?
No.
You don't go out and cut grass, right? No. No. But do you have people that do this, Bill?
Yes.
We kind of, for the homemaker home health aides, we kind of draw the line at light housework, I
Light
think.
housekeeping. Yes.
And then anything heavier duty cleaning, that would be the home and property care side. And yes, because we manage and maintain probably 100 facilities in Union County, residential facilities, we have a whole team of facilities and property management guys and ladies, sorry, a team.
Yeah,
And,
get the genders right, otherwise, you know.
That's right. And who are capable of dealing with pretty much any kind of routine maintenance, small repairs, and certainly property maintenance kinds of things. So we can cut grass, do leaf removal, snow removal, if it's shrub trimming or tree trimming, as long as it's not really big, big stuff that requires a licensed contractor. And then inside we can do any kinds of small repairs or chore services, which could include deep cleaning or clutter removal, helping someone to organize their belongings, because one of the issues, certainly as we all age, is that memory issues and the ability to stay focused and cognizant at all times declines a little bit, so people sometimes lose track of organizing their own things. We can also do accessibility, mobility kind of equipment, like grab bars, handrails, lowering countertops, expanding bathrooms. Well, now we're getting into residential modifications there, but we can expand bathrooms so that they're disability accessible, and we can actually install or work with contractors to install ramps.
So, go ahead. No.
I was going to say, so kind of the dividing line on who does what is our current property and facilities crew can do all of those things up to residential modifications. When we get to residential modifications, those require licensed contractors. We do have a general contractor who works with us, who does all of CAU's home improvements and building construction. You saw the new building on Jersey Street. So he's very competent, and he has his own cadre, if you will, of licensed specialty contractors who can work with us to do any kind of residential improvement.
So, Barbara, you talked about 2 days a week that Donna comes over. Where would you be without Donna, number one? And number two, what do you do when she's not there?
I try to maintain, I live by myself, I'm divorced, so I try to walk around my apartment without this cane, trying to get the strength and not being afraid, okay, in my house. But I can't wait till I get somebody to help me to get out, okay, because that's the most important thing, is to get out of the house. I have 6 steps I'm on the first floor, but still I have 6 steps. And to go up and down, I can't use my shopping cart like I used to. It's, they help you. They help you, and they give you I mean, she'll come, and I have my coat on.
Yeah,
You're ready to go.
Ready to go.
I'm ready to go, okay? And it has gotten me to the point, I feel very good to be able to go to the Roselle Active Seniors programs, because
Now, will you take her there to that event, Donna?
No,
I don't take her here. She goes on her own.
I drive.
You
Yeah,
drive,
she goes
okay.
on her own.
She's gotten me to get back in my car.
You've helped her do that.
Yes.
Yes.
Because I help her with
Yes.
mobility
So you're kind of
issues.
getting back to independence.
Yes.
Yes, I'm getting back to what I used to do. I'm not afraid. And the programs, besides this program, we as I am a Roselle resident, we have programs to go on trips. Like this Saturday, we're going to Huntington Hills for St. Patrick's Day.
Oh, good.
Dinner.
Corned beef?
Yeah, well, I had corned beef on Friday
I know,
because
there's too much of it going
too
around.
much. So I'm going to have the shrimp.
There you go. So, before we wrap it up, Donna, what made you become a home health aide?
Well, I think
And how's the experience been for you?
it stemmed from me working with, taking care of my dad, because my father wasn't able to read, and he was the 13th child out of his siblings, and he was the baby. So he had to work, as a young child. And my father never got the opportunity to read. So I was always the one to help him. I didn't realize he wasn't able to read until later on in life. And then I was like, Dad can't read. So I would help him with all his mail, his business, going to the bank for him and, showing him how to use the ATM machine and things like that. So when the opportunity presented itself for me to become a home health aide, I was like, oh, good, I can broaden my horizons and pick up where I wanted to do for my father, to help my dad.
I want to thank the three of you for taking the time to join me on the show. And I really appreciate the interaction that you have, Donna, along with you, Barbara. I mean, it's absolutely terrific.
you.
And Bill, thank you for your work with Community Access.
Thank you, Mayor
Wish you
Baldwin.
lots of
Really
good fortune.
appreciate the
Thank you.
opportunity to be on with you.
I want to thank Mr. Bill Webb, Miss Donna Hunter, and Miss Barbara Blaize for coming here to the show this evening and talking about the Community Health Aid Project at Community Access. We'll see you next week on another edition of Our City.
We have some of the finest teachers in the country. And then they graduate. Kane University.